Welcome back to the latest episode of Taking Charge of My Cancer. And I have a pleasure to have a very special guest today, Steve.Cooper. Steve is a lifelong resident of the state of Maryland. He is married to his beautiful wife, Robin, who he met in high school over 50 years ago. Steve underwent a total laryngectomy in February 2019 and received his tracheoesophageal voice prosthesis, or TP, in September 2019. He owns and still actively manages a national wholesale food brokerage business. He is a current and former board member of the Governor's Advisory Board for Telecommunication Relay in Maryland and the Speech Disabled Representative, the International Association of Laryngectomies, Web Whispers at the Laryngectomy Club at Montgomery County in Maryland. And additionally, he is a mentor for the Imerman Angels Cancer Support Group. Previously, Steve was a licensed in real estate and held the National Association of Security Dealers. He shared that because of the early help and ongoing mentioning that he received from many of the wonderful members of the laryngectomy community, he being installed with a heartfelt desire to assist other laryngectomies or family members in any way that he can. He continually welcomes the opportunity to meet with new patients, family members, speech pathologists, and others, and to be a staunch advocate for the laryngectomy community, and has always found it to be a very rewarding experience. So it's really an honor to have you here, and thank you for agreeing to be my guest today.
Thank you so much for inviting me.
Absolutely. So you want to tell me a little bit about your role and your mission right now?
My vision.
Your mission.
Oh, mission. I'm sorry.
That's all right.
Prior to being diagnosed with cancer and my surgery, I wasn't real active in volunteering, but after the surgery, as you put it, I've made it my mission to help others who have gone through the procedure of having a laryngectomy. It's a life-changing operation, and there's not a lot of pre-surgery education, mentoring. We kind of picked up things on our own through Facebook, internet. If we're lucky to have a local club, that's always been help. But and like I said, it's very common with many of the laryngectomy patients to want to help others so their journey is a better experience. The new patient's journey is a better experience than what we went through. So I've kind of made it my mission to help others in this process.
That's amazing. And I learn so much from you guys every single time when I meet any of you here in my practice or in the practice where I work. Just because really, you're right, it's a totally changed gamer. It's really, you go from be able to talk and express yourself to not be able to, then you have to learn all these devices to be able to communicate. And communication is such a key in our daily living, right? So sometimes I feel really bad. Sometimes I have patients who come here with the electrolysis, and then it's like, what are you saying? It's just really hard. And it's like, oh my God, I don't want to, because I know how uncomfortable the patients have to feel it. Like, really, you're the one who's supposed to be understand what I'm saying, and you're not. So and then we just really come along really well. But yeah, but definitely it's a totally a lifestyle change. What type of symptoms did you experience that made you go to the physician?
For about a year, I would lose my voice. I would get hoarse. I would seem normal for maybe a few days or a week. Sorry, speaking with a voice prosthesis, we swallow a lot of air.
Yeah, no problem. No problem. Yeah.
For about a year, I would get hoarse, lose my voice for a few days, maybe a week, it would come back, just like we've all had that happen, laryngitis. And it started happening more frequently. I would last longer, take longer for my voice to come back. And then it got to the point where it was basically like permanent laryngitis. I just could speak with a whisper, and it was very difficult. I would almost have to push the air to be able to, get the vocal cords to work. So I went to see a ear, nose, and throat doctor. Otolaryngologist is the full term. Um, Ear, nose, and throat, or ENT, is what they're referred to. And he did a scope where he sticks this small tube with the camera down the nasal passage, looks into the throat, looks at the throat, the vocal cords, and he said, you have some paralysis on one of your vocal cords. It's not a big thing. I'm going to send you to a specialist, and she'll be able to work with you and get you talking again. And this was in December of 2018. And he said, no rush, just make the appointment when you can. And he referred me to a laryngologist that connected with one of the Johns Hopkins hospitals in the area in Bethesda, Maryland. And so I go, and it was about a month before I got the appointment. Now it's mid-January. And she said, your doctor didn't send the video of the scope. Do you mind if we scope you again? And I said, oh no, I love having that thing shoved down my nose. My favorite thing to do. I said, but go ahead. And she had another doctor that was working with her. I think it was a resident in training. So this doctor, she goes and she scopes me. And, she's shoulder to shoulder with me. I'm in a chair. But she's, feeding the scope down my nasal passage. And we're looking at a monitor in the room. And she turns to the other doctor, and she, in this very solemn voice, she says, do you see what I'm seeing?
Oh, no.
And instantly, the mood in the room changed. It was like, prior to that, we were joking around. Suddenly, there was no more joking. It became very solemn, very serious. So she said, Steve, I see some things I'd like to run some more tests on.
Mm-hmm.
And I said, doctor, this is everybody's fear. I said, is it cancer? And she said, well, I don't know. I can't say. There's tests. We want to do a CT scan or a PET. So I said, look, you're an expert at this. Are you concerned that what you're seeing is cancer? And she turned to me and said, yes, I am. So I was scheduled for a PET scan, and then followed up with a needle biopsy to take a tissue sample. They had trouble taking a sample through the scope with the device, like little pincers that would snip off a piece of the tissue. So they ended up doing a needle biopsy. And the results came back, stage 4 squamous cell carcinoma of the vocal cords.
I am so sorry. Yeah.
And that was in that was late January 2019. And so I met with the surgeon, and we had some consultations from there.
Okay, got you. What type of surgery did you end up having besides your total laryngectomy?
Well, the meeting with the surgeon, and he gave me the results, and he said, radiation may be an option, but you're stage 4. I recommend a total laryngectomy. Basically, they do a bilateral neck dissection. They cut you literally from ear to ear, open your throat, remove the voice box, the larynx, which voice box, it also holds the vocal cords. The swallow sphincter is removed. They also removed 32 lymph nodes in the neck area and half of the thyroid. And this procedure, well, that was the operation. Before I consented, I said, well, what if I just do radiation? And he said, stage 4 does not have. He said stage 4 radiation is not effective, and there's a most likely you'll be back in a year after having been radiated. You're going to need the surgery anyway. Then the tissue will have been compromised through radiation.
Yep.
Makes it a lot more complicated procedure. The healing process is more difficult, and it presents a whole new set of problems. So I said, okay, what if I do nothing? And I'll never forget. There's a lot of things I don't remember from this time period. Our mind spares us with very traumatic events, fortunately. But I remember when I said, what happens if I don't have the procedure? He looked at me and he said, you will die a very ugly and painful death.
Oh, wow.
So, really had no choice. And so on February 25th, 2019, I had a bilateral neck dissection and complete total laryngectomy. It's roughly an 11-hour surgery.
Yeah.
Recovery. I was 3 or 4 days in intensive care, and I was in the hospital for a total of 11 days. And that's pretty much the norm. It's rare it's rare they are discharged before 7 to 10 days. And some will stay months if they develop a complication. So it's a really radical procedure.
Yeah. Do you know if you have any lymph nodes were positive?
Luckily, pre-surgery, we were discussing having the surgery, and then, which is very common, they do radiation after surgery. Make sure in case they missed, one microscopic cell could, bring on a reoccurrence. When they, as I said, they removed 32 lymph nodes. Fortunately, every one of them tested negative.
Good.
And the margins from the surgery itself all tested negative.
Okay.
So my doctor lobbied the surgery was done at Suburban Hospital in Bethesda, Maryland, which is a Johns Hopkins hospital. So my doctor lobbied the tumor board for Johns Hopkins to allow me to skip radiation. And they agreed. So fortunately, and that's because there was no invasion into the lymph nodes, the main reason. He said, look, we can always do radiation later. For now, we're going to monitor you closely. First year, you'll have a scan every couple months, every 3 months, then we'll move on to every 6 months. And then after a year, we'll have a scan. We'll do a scan annually until the 5-year mark. And fortunately, if you do the math, this February was 5 years.
Awesome, awesome. So this is your anniversary, survivor anniversary.
Right, right. And they used to say, you're cured after 5 years.
Mm-hmm.
Now they don't say that.
Mm-hmm.
They just say no evidence of disease
Yeah, yeah,
because I guess, cancer can come back anytime
yeah.
in any fashion.
Absolutely, absolutely. Well, I'm glad you didn't have to go through that. And then we talked a little bit early before we actually start recording about that you developed this condition called lymphedema, which is swelling of the neck. When did you start going to physical therapy to for them to start helping you with it?
With laryngectomy patients, because of the surgery that has sutures, you've got sutures literally from ear to ear. A lot of sutures internally. They don't like to let you start lymphatic therapy, lymphatic drainage therapy for, I think it was 2 or 3 months.
Oh,
They want
wow.
to make sure everything heals.
Mm-hmm.
They want to make sure everything heals before, even though it's a light pressure, they don't want to be, they don't want the patient or the therapist applying pressure to the neck area or, forcing that
Yeah,
fluid to move
yeah.
because it can create a fistula, which is a tear in the esophagus, or the sutures might create a tear, and that opens us up to a whole new world of problems. But it was about 2 or 3 months.
So right now, so and now things has changed quite a bit in that respect since were exposed to this. I don't know if that was we no because that was already 19, so about 5 years ago. So maybe it's by institution. Here at UF in Gainesville, we actually love to see you guys at 2 weeks post-op to try to start getting things moving in the right direction. Right, we don't necessarily are going to be working specific at the scar until every stitches and all that is nice and healed. But we can start to really work on all that tissue surrounded to open up those pathways for that fluid to go to. So the manual lymphatic drainage is just a piece of what we do, right? So we're looking at neck mobility, soft tissue mobility. I don't know if you have any issues with your shoulder, but many times a lot of patients end up having something called a spinal accessory nerve injury, where the shoulders get compromised because the nerve goes right in the middle of those lymph nodes on the neck. So sometimes we like to start working on all those conditions early on to try to really help so you guys don't establish that pattern of pain or guarding or more fibrosis because the accumulation of the lymphatic fluid that contains protein in the area. So we tend to be a little bit more proactive on that respect. Now, not every patient is able to do it at 2 weeks post-op because sometimes patients have complications. They end up in a rehab place for like a month, or they end up getting home care, and then sometimes they not end up coming here and see us until 4 weeks later. But definitely the sooner you can get to a physical therapist, the better. And the other thing we used to do better, we are not doing it as much now since COVID, but that was to see you guys pre-op. So we see you as a pre-op, so we can have a baseline, right? So we can take some circumferentials of your neck and your face, and then we know where you are at, so we can compare something afterward. Because if you come afterward, I don't know if that second chin was a second chin prior of surgery or not, right? Or how big was. So it's nice for us to not only look at that, but look at the biomechanics of your shoulder and your scapula to see if has been any difference before and after. So this has been changed a little bit. Again, we were doing that even then, but sometimes every institution is a little bit different.
Yes, you asked about, or I was talking about lymphatic therapy.
Uh-huh.
Yes, I did have, when I was discharged, they sent a home care nurse
Mm-hmm.
a couple times a week. And he did work on the scar tissue, did work on some mild stretching. So I forgot, what is it, myofascial release?
Yep. Yep.
Yes, he worked on that uh, within 2 or 3 weeks.
Mm-hmm.
And some of the mild physical therapy. Um, and that was, 2 weeks after discharge. So, yes. And I know how important the myofascia is because that can really, if it's not addressed, can
Yep.
lead to some long term problems. When I was discharged, I couldn't raise my arms. Um, I couldn't raise my hand to the level of my shoulder
Mm-hmm.
because of the nerves that were cut and the
Mm-hmm.
muscles that were impacted.
Mm-hmm.
But and then after home care, I went into a very intensive physical therapy program, and
Okay.
now I have no limited mobility whatsoever. And I credit that to the early therapy that I
Mhm.
received.
Yep.
Now, as far as lymphatic, it was ironic. I had to ask my surgeon for it.
Oh, wow. Mm-hmm.
He didn't, they kind of, once they did the surgery, they were done with me.
Mm-hmm.
Um, things hopefully are done a little different now.
Yeah, yeah.
But
I think that now in the cancer world, not just from the head and neck standpoint, but in general, I think that now physicians and surgeons are more worried about quality of life, right? And the survivorship. And yes, you guys are done with treatments, but then what happened after? So I think that a whole of things are turning more towards that. And that's why as well, a lot of things evolutionate more towards like less is better than more, right? So if we don't need to go to these extensive surgeries, why should we do it if the survivor time is the same, if the recurrence percentage is the same, and so forth? So I think we're getting better and better about doing all that, just thinking about quality of life, because you may be cancer free, but if you have all these issues, it is really worth it, right? If you don't have a good quality of life. So that definitely has been improving quite a bit. Perfect. Um,
yeah, what you led to, and it's becoming, it's used more often as multidisciplinary care.
yep, absolutely.
I did not receive that.
Mhm.
Many institutions that I have spoken at or that I'm familiar with are very big on that, and it's so important.
Yep, yep, absolutely, absolutely. Yes, it is to the point that, as a physical therapist, like I'm part of the tumor boards. So, like right from the beginning, we are there, we're learning, we're giving our opinion, we tell the physicians the value of physical therapy, we educate them. We educate them about lymphedema, we educate them about lymphatic, and not just that, but in general, TMJ, mobility, all those kind of different things that can happen along. Um, will you give us 3 valuable tips that you learn about your journey? I know it's so many. So
Yeah.
pinpoint like the 3 most important ones.
Well, generically, for cancer patients,
Yep.
and then specifically for laryngectomy care patients, um, reach out and find support groups. Find them early. That's the biggest key. There's so much to learn. Your care team is not going to be able to. People often ask me, "Okay, Steve, tell me what I need to know." That we have patients that are 40-year survivors that still haven't learned everything they need to know.
Mhm.
So, getting involved with a local support group, finding a mentor. There's many ways, Immerman Angels has a great mentoring program. Um, if you join well, through your hospital, the care team might be able to have you meet with a patient, and you can see that there is life after surgery.
Yeah.
That is crucial. There's a lot on Facebook where you can get great support groups. That's the I think the biggest key in the path to your recovery. That's one that I've learned. Number two, and it's one lesson we shouldn't have to learn, is you have to be your own advocate in
Yeah.
the medical community, not just with your healthcare team, but more so with your insurance providers.
Oh my God.
Your doctor's telling you what you need, and the person on the 800 number at the insurance company, who probably never went to college,
Yeah.
says, no, you don't need that.
It's so sad. It is terrible.
Yeah.
It is so terrible.
But, and with laryngectomy patients, so many times the medical professionals, it's such a rare procedure that they're not familiar with our needs. So we really have to go in there and fight for the care. In the hospital, the nursing station, they were afraid of me. They didn't know how to suction somebody with a stoma.
Yeah.
They would call respiratory therapy. My wife walked by the nursing station and she heard the nurse says, he needs suctioning, and I ain't touching that thing. Let's get somebody from respiratory therapy. She went off on him. She said, you better learn how to do this.
Absolutely. That's
So,
no excuse for that.
yeah.
Yeah, that's terrible. Yeah.
And, I don't mean to be disrespectful to the medical community, but there are situations where you really have to fight
Yeah. Yeah.
for your needs.
Yeah.
Those are the two big takeaways. The third, in my case, is pay it forward, get involved. If you can help the next person, be an advocate, then any problems you may have experienced will be a little less for the next person.
Yeah. Yeah. That's amazing. That's great. That's really that actually lead me into the next one I was going to ask you, and you kind of already respond part of it. Is like, what type of resources would you advise patients with head and neck cancer to go look for it? You mentioned already the NMR Angels, some of the Facebook groups. Any other particular social or or books or podcasts or anything in
Yeah,
particular that you recommend?
there are some great cancer resource groups. Oh, you called me off guard.
That's all right. Yeah, you can always send it to me, and I'll be happy to put it on the show notes.
Yeah.
So people
American Cancer Society has some resources.
yeah.
The charity that I'm involved with, Lary's Speakeasy, that's Larys, Speakeasy. We have some resources where you can get a lot of assistance for cancer, education.
Mhm.
I'll send you some
Yes, absolutely. Yes. And then
links.
I'll put it.
Facebook, if it's pancreatic cancer, Google, go into Facebook and type in pancreatic cancer. There'll be a support group. If it's breast cancer, go in. Now, you have to be careful because a lot of times people are giving advice that's not accurate.
Yep.
But you kind of sift through the responses. It's funny because my doctor used to call it, he says the patients learn more on Dr. Facebook than from any provider they could ever meet.
Yeah, that is true. And sometimes I tell patients to just be careful with Dr. Google. So sometimes you go in there and you can find very scary things. So always make sure that you're really looking into websites that are really medical, scientific proven. Like you mentioned, American Cancer Society can have a lot of different links that you know for sure is based on research and is based on scientific models versus the experience. And sometimes even with some faith groups, uh, I, I got patients telling me, sometimes you go into these face groups that somebody who didn't have a good experience is very negative, and then you may don't want to listen to that, you may don't want to hear that, so you may want to just make sure that if you're going to a support group, you got to have a happiness, some kind of like hope, some kind of like a good vibe, good energy, being just negative, because that's not good for your soul. So
You
sometimes it's really watch what you are following and what you're reading and what you're listening to.
mentioned to be careful, don't go and just Google. Um, in these Facebook groups, a lot of times you'll see all these negative, all these horror stories. And, people have this problem and that problem. I always caution people that, if you're having a good day, you don't go around, go onto Facebook and say, I had a great day today. But if you have a problem that day, you run to Facebook and you say, oh my God, I have this problem. What do I do? So, a lot of that, I don't want to diminish from people who do experience problems. But a lot of what you see are those that are experiencing problems, not the ones that have recovered and have moved on and have positive experiences.
Yeah.
So just keep that in mind.
Yeah.
When you see these horror stories, that's usually the minority. It
Yeah.
might be only 5%,
Yeah. Yeah.
but
Yeah.
you know,
Absolutely.
it's the reality.
Yep. How about one painful, if you like, if you can give us like one painful lesson that you learned through your journey?
Painful lesson was what insurance companies will do to you.
Okay.
I fought for 9 months to get laryngectomy supplies, basic stuff. The insurance company doesn't understand what a laryngectomy patient is. Finally, and I'm going to call them out by name, it was Blue Cross Blue Shield. They're notorious for denying patients laryngectomy supplies. They have it listed under tracheostomy, and it's we have different needs. So when we ask for these things, they say, oh, trach patients don't need that. But it took 9 months. At one point, I had a care navigator through Blue Cross Blue Shield, and she said, you will never be allowed to go out of network. So stop looking, stop asking.
Oh my
Which
God.
was not true, because if they can't provide the supplies,
They
they
have
must allow me to go out of network. They don't
absolutely.
have a choice. Anyway, after fighting literally for 9 months, I had to go to a charitable organization to get my laryngectomy supplies. After fighting for 9 months, they finally approved my out of network exception. They warned me it would take 3 months to send the contract to the provider, to the manufacturer.
Mhm.
They did. So now we're at a year post surgery. I started ordering supplies because I was approved. They rejected the claim, saying I was out of network.
Oh my God.
They resubmitted. They said, no, he's in network. We had an exception. They said, oh, you've got to send a copy of the document. He said, wait a minute, it's your document.
Oh my God.
This went on for an additional 6 months. It's criminal what they do to the patients. Now, that's a painful experience with the system. painful experience personally. Not being able to speak. I didn't have a voice prosthesis for 7 months.
Oh, wow.
I tried to use the electrolarynx, but I struggled with it. Couldn't be understood. In about 3 months, I kind of had not a true mental breakdown, but I fell apart. I was on the floor in a ball crying
Wow.
and having no vocal cords. We can experience crying, but we make no sound.
Mhm.
That that moaning, that wailing that you do when you have a good cry, we can't do it.
Oh,
So it
wow.
made it even worse.
I'm
The
sorry.
agony, it was unbearable. So I made an appointment. I saw a therapist,
But that was gonna
and
be my next question. Yeah,
that
yeah,
was very helpful.
yeah. That was gonna be my next thing. Like, did you have some mental support and counseling through all this time to get, adapt to the new life?
Yeah, when actually during my 30-minute preoperative counseling with my surgeon, 30 minutes,
Uh-huh.
and 30-minute preoperative counseling with my speech pathologist, which is very inadequate. The surgeon went over a few things, but he said, do you have a therapist? Do you go to a psychiatrist or a psychologist? I said, no. He said, you're going to need one. And I thought to myself, why you're operating on my throat? You're not operating, you're not doing brain surgery. Why am I going to need a mental health professional? And fine, at the 3 month mark, that's when I realized. And when I went to see her, and I had to write down most of my questions
Yeah.
because I wasn't speaking,
Yep.
and very, very limited use of the electrolarynx. Uh, and so, after about 15 minutes or so, she said, Steve, here's the problem that I see. Our voices are a personality, it's who we are. She said, you are in mourning over the loss of you. And I thought about it for a second, and I thought to myself, I'm in mourning over the loss of me. I'm sitting right here. How could I be in mourning? This is nuts. How did I ever pick this person? She's a quack. Well, before the end of the session, she was spot on. The
Great.
not being able to express ourselves is devastating. And so I went to therapy, actually went on medication, um, Wellbutrin, which is a very common antidepressant, for about a year, and then took myself off, stopped therapy after about 2 years. A year or so later, started getting down in the dumps and went back to therapy. And actually, it's really great to be able to talk to a neutral person.
Yeah, yeah. I think it's good. It's good. Um, how about looking into your bio? You mentioned that you are part of the Governor's Advisory Board for Speech Disabled Laryngectomy Club. You want to tell me a little bit about that?
Um, well, they're two separate things. The government advisory board for telecommunications relay. In every state, they have relay. You dial, if you're deaf, if you can't speak, you can dial 711 and use a device. You can type in, and an operator will revoice your conversation. For a deaf person, you can, I can, the deaf person can dial 711. They type in the conversation. They call it a communication assistant. They
Mhm.
will the repeat it to the party they're calling. Then when that party answers, communication assistant will type it in, and then the person will be able to read it on their device. If for the speech community, I can type, they'll revoice it, or if I'm using the electrolarynx,
Okay.
she can repeat what I say in case the other person doesn't hear it. And then, of course, I can hear what the response is.
Okay.
So that position, we oversee Maryland Relay. We bring issues that are important to the the deaf community, speech impaired community, to Maryland Relay, and then kind of oversee their process.
Okay. Got you. And how about the speech disabled representative?
Well, that's what I do with Maryland Relay.
Okay.
The other one is the laryngectomy clubs. I'm a board member of our local laryngectomy club.
Got you.
There's countless numbers of clubs in the U.S. and they're for really any illness. There's so many support groups, but this is the Laryngectomy Club of Montgomery County, Maryland.
Got you.
And I run our Zoom meetings, contribute to our newsletter, but we have a monthly Zoom meeting where people from all over the country, all over the world have joined us.
Okay.
South Africa,
That's amazing.
Lebanon, you name it,
That's
the UK. We often get referrals from speech pathologists, from doctors. Hey, we've got a new patient. Can you go and talk to them? So we provide pre-surgery counseling and then post-surgery support.
okay, great. Awesome. Stephen, any one question you wish I will have asked you and that will you have answered to wrap up?
Well, one thing you said, it's not an answer to this question, but it took me back to one thing you said, that sometimes the patients, you have difficulty understanding them. And I always tell people, I went through this. I had a family member who couldn't understand me. Before I got my voice prosthesis, I was using the electrolarynx. I'll try and give a sample so, your audience can hear what it's like. But it's a device that vibrates, that's placed under the neck. When I press the button, it vibrates. The vibration goes into my oral cavity, into my mouth, and I form the words just like you do, talking person. Hello, how are you? Can you understand me?
You're actually doing that really well.
Yeah.
You're managing
So
that. Yeah.
Yeah, it takes time.
Yeah.
But I was using that, but it was more like this.
Yeah.
And no one could understand me.
Yeah.
I wasn't using it properly. And I had one cousin after I got family member, after I got my voice prosthesis, he said, Steve, I didn't want to insult you, but when you were using the electrolarynx, I couldn't understand a word you were saying, but I didn't want to insult you. So I just nod my head and I go, yeah.
And that's worse for you because you know you know.
And I said, I thanked him, but I that was actually so insulting, and he didn't mean it, or didn't realize it. But I was talking, he didn't understand, but he didn't stop me to ask me to repeat because he didn't want to embarrass me.
I got you.
And so I said, you mentioned you have some patients. Sometimes you can't understand. I always tell people with a laryngectomy or any other disability, if you can't understand them, simply say, I'm sorry, I didn't catch that.
Yeah.
Could you repeat it?
Yeah. Yeah.
It's, it's so important to us,
Yeah.
you
Absolutely.
know.
Absolutely. One thing.
So
Yeah. One thing.
that's one thing
Yeah.
I like to tell people.
Yeah, that's great. One thing I tend to do is if we give it a try, because I want them to practice and I want them to master that. And so we try, but we try and we try. And if that doesn't happen, it's like, let me just read your lips, or we just do the board, right? The board. Let's just communicate that way. But I want that to communicate with them. I love to, throw jokes and just really have a fun kind of like PT visit and know about you guys like any other patient. So yeah, I'm very known like for asking a lot of questions throughout. And then it's like, oh, I'm asking all these questions, but I'm working on your jaw, your neck, and you really cannot answer me right now because I'm working on you, right? That's typical. And then, but then again, usually, I a lot of the family members, wife or husbands of the patients, they usually are there to try to help translate or to communicate. But yeah, but you're right. It is important. And I've been telling patients, let's just maybe don't use this until you continue working with the speech pathologists and you continue learning with them how to manage this device. And let's just do, I like to read your lips, or we just communicate with like what they're writing.
You said something that's very crucial. Um, One is, well, a couple things. If they're struggling, don't push it. Tell them to write it down
Mhm.
because we're just getting frustrated.
Yep, yep.
It makes it worse. Um, when I use an electrolarynx, I would always tell people, don't look me in the eyes, look at my lips.
Mhm.
You know, it'll help your mind to interpret what I'm saying
Mhm.
if you look at my lips. Our minds don't, even with my voice, it's not quite normal. And the electrolarynx especially.
Mhm.
Our minds don't allow us to accept it as speech. It's
Mhm.
some other noise.
Mhm.
So our minds we have trouble processing what the
Mhm.
person is saying.
Mhm.
So looking at the lips, concentrating on the sound
Mhm.
will really assist in understanding what that person's trying to say.
Yeah. So imagine, Steve, when we were having COVID and everybody has to wear a mask. That was disaster with those electro. It's like, oh my God,
Oh
this
yes.
is not going to work with a mask. I need to read your lips. And that was very hard.
Same thing with people that are deaf but can read lips.
Yes,
They actually make see-through masks for that purpose.
yes, yes.
But even if when I wear a mask, it muffles my sound,
Yeah,
so it makes it much more difficult for
exactly.
someone with compromised speech wearing a mask. It just compounds the issues.
Yes. Steve, that was a wonderful conversation. I can keep you here for hours. It has been really a joy to have you today in this podcast. I really appreciate you and everything that you do for other people that has been going through the same things that you've been going through. So glad that, like you say, it's always about giving back, right? That's part of what I do this podcast. It's like I want people to just get educated and learn experience from not just physicians and other healthcare providers, but as well from other patients who I think can be bring a lot of valuable tips to them. So I really appreciate it.
Thank you. And if anybody is intrigued and wants more information, they can contact me through larryspeakeasy.org, LARYS speakeasy.org. On the about on the our team page, there's a link to my email address. But I want to thank you, dearly, for inviting me to this podcast and trying to bring awareness to the struggles and the challenges with the laryngectomy community. This is just so valuable to patients and the medical providers everywhere.
Yeah, thank you. And thank you. Sorry. Thank you for adding that up. Yeah, one of my questions was how can people find you? So I'm glad that you mentioned that, but I was planning to put that on the show notes too. So there will be links for that. So people just can click and get it straight to the link. So I really appreciate it.
Thank you again. Thank you.
You're welcome, and you have a great evening.
Thank you.